Lung cancer is consistently one of the top 3 deadliest cancers worldwide. Here are 15 reasons why. 1. Late diagnosis. Lung cancer often remains asymptomatic until it reaches an advanced stage, making early detection difficult. 2. Aggressive growth. It tends to grow and spread rapidly, especially small cell lung cancer (SCLC), which can metastasize early. 3. High metastasis rate. Lung cancer easily spreads to other organs like the brain, liver, and bones, reducing survival chances. 4. Limited early screening. Unlike some cancers e.g., breast or cervical, routine lung cancer screening is not widely accessible, and only high-risk groups are recommended for screening. 5. Strong link to smoking. Cigarette smoking is the leading cause of lung cancer, and quitting doesn't immediately eliminate risk, as damage accumulates over time. 6. Environmental and occupational hazards. Exposure to pollutants like asbestos, radon gas, and air pollution increases the risk, affecting even non-smokers. 7. Poor treatment response in advanced stages. Chemotherapy, radiation, and targeted therapy become less effective when lung cancer is detected late. 8. Resistance to treatment. Many lung cancers develop resistance to targeted therapies and chemotherapy over time, making them harder to control. 9. High recurrence rate. Even after successful treatment, lung cancer has a high likelihood of recurrence, leading to lower long-term survival rates. 10. Difficulty in surgical removal. Surgery is effective only in early stages, but most cases are detected when surgery is no longer a viable option. 11. Limited awareness and misinformation. Many people don't recognize lung cancer symptoms, like a persistent cough or shortness of breath, early enough to seek timely medical help. 12. Lack of curative treatments for advanced stages. Unlike some cancers with high cure rates, advanced lung cancer is often considered incurable, with treatment focused on prolonging life. 13. Comorbidities and overall health impact. Many lung cancer patients have existing health issues, e.g., COPD, heart disease, that complicate treatment and worsen prognosis. 14. Poor prognosis. The 5-year survival rate for lung cancer is low compared to many other cancers, particularly in late stages. 15. Global prevalence and rising cases. With increasing pollution and smoking rates in some countries, lung cancer remains one of the most commonly diagnosed and deadliest cancers worldwide. These factors contribute to lung cancer being one of the top 3 deadliest cancers, with survival rates significantly lower than many other cancer types. Bronchus cancer, often grouped with lung cancer, is among the top 3 deadliest cancers worldwide. Here are 15 reasons why. 1. Late diagnosis. Bronchus cancer is often asymptomatic in its early stages, leading to late-stage detection when treatment options are limited. 2. Aggressive nature. The disease progresses rapidly, often spreading, metastasizing, to other organs before diagnosis. 3. High metastatic potential. Cancer cells in the bronchus can quickly spread to the brain, liver, bones, and lymph nodes, reducing survival chances. 4. Limited early screening methods. Unlike breast or colorectal cancer, there is no widely adopted screening method for the general population, making early detection rare. 5. Strong link to smoking. Smoking is the leading cause of bronchus cancer, and because smoking damages lung tissue over time, many patients develop cancer after decades of exposure. 6. Environmental and occupational risks. Exposure to pollutants, asbestos, radon gas, and industrial chemicals increases cancer risk, particularly in urban and industrial areas. 7. Poor prognosis. The 5-year survival rate for bronchus cancer is significantly lower than for other cancers, often below 20%. 8. Resistance to treatment. Many cases of bronchus cancer, particularly small cell lung cancer (SCLC), respond poorly to chemotherapy and radiation, leading to treatment failure. 9. Lack of symptoms until advanced stages. Early bronchus cancer may not cause noticeable symptoms, leading patients to seek medical attention only when the disease has progressed significantly. 10. Limited curative treatment options. Surgery is often not an option because most cases are diagnosed at an advanced stage when the tumor is inoperable. 11. High rate of recurrence. Even when treatment is successful, bronchus cancer has a high recurrence rate, often returning in a more aggressive form. 12. Ineffectiveness of targeted therapies for many patients. While targeted therapies exist, only a subset of patients benefit from them due to genetic differences in tumors. 13. Comorbidities and weakened lungs. Many patients already have compromised lung function from smoking or other lung diseases, e.g., COPD, making treatment more difficult. 14. High mortality even with treatment. Even with aggressive treatment, bronchus cancer remains one of the deadliest cancers due to its rapid progression and treatment resistance. 15. Global prevalence. Bronchus cancer is highly common worldwide, particularly in regions with high smoking rates and air pollution, contributing to its ranking among the top 3 deadliest cancers. Would you like details on prevention or treatment advancements? Colorectal cancer, CRC, is one of the top 3 deadliest cancers worldwide due to several key factors. 1. High incidence and late diagnosis. CRC is one of the most common cancers, especially in developed countries. Many cases are diagnosed at an advanced stage when treatment is less effective. Early symptoms can be vague, e.g., mild abdominal discomfort, changes in bowel habits leading to delayed medical attention. 2. Aggressive progression and metastasis. If untreated, CRC can rapidly spread to vital organs like the liver, lungs, and lymph nodes. Once metastasized, treatment options become limited, and survival rates drop significantly. 3. Lifestyle and risk factors. A diet high in processed meats and low in fiber, obesity, smoking, heavy alcohol use, and sedentary lifestyles increase CRC risk. Genetic predisposition, e.g., Lynch syndrome, familial adenomatous polyposis, also plays a role. 4. Limited access to screening and prevention. Colonoscopy and stool-based tests can detect CRC early, but many people skip screenings due to cost, lack of awareness, or fear. In low-income regions, access to early detection and advanced treatments is often poor. 5. Treatment challenges and recurrence. Surgery, chemotherapy, and immunotherapy can be effective, but recurrence rates are high, especially in advanced stages. Some tumors develop resistance to treatment, making them harder to control. How to reduce the risk? Regular screening, especially after age 45 to 50. Healthy diet and active lifestyle. Avoid smoking and excessive alcohol consumption. Awareness of family history and genetic counseling if necessary. Would you like more details on prevention or treatment options? Pancreatic cancer is one of the deadliest cancers for several reasons. 1. Late diagnosis. The pancreas is deep inside the abdomen, making it difficult to detect tumors early. Early-stage pancreatic cancer often doesn't cause noticeable symptoms, so by the time it's diagnosed, the cancer is often in advanced stages. 2. Aggressive growth. Pancreatic cancer tends to grow and spread, metastasize quickly, making it harder to treat once it has progressed. 3. Limited treatment options. Surgery is often not an option for many patients because the cancer has spread too far by the time it's detected. Chemotherapy and radiation can sometimes be effective, but they are often less successful with pancreatic cancer compared to other cancers. 4. Lack of effective screening. There is no routine screening test for pancreatic cancer, unlike for breast, colon, or cervical cancers. This means many people aren't diagnosed until the cancer has already spread significantly. Due to these factors, pancreatic cancer has a poor survival rate, with fewer than 10% of patients surviving for 5 years after diagnosis. These elements contribute to it being one of the top 3 deadliest cancers, alongside lung and colorectal cancers.